Let's talk about social anxiety. We will explore the complexities of social anxiety and potential treatments. So social anxiety disorder, also known as social phobia, it's not just shyness. It's a debilitating condition, and it affects millions of individuals around the world. So today we'll look closely at how common it is, some of the causes, clinical manifestations, diagnosis, and treatment options for social anxiety. So SAD, social anxiety disorder, comes with excessive fears of scrutiny, worry about embarrassment, worry about humiliation in social or performance situations. And it leads to significant distress and impairment in functioning. And it affects both personal life and professional life. Let's talk about prevalence and risk factors. So SAD is very common. It affects between 3 and 7% of the adult population in the United States. And it typically begins in childhood or adolescence, and it can lead to a variety of mental health problems in addition to social anxiety, that are unrelated to social anxiety. The risk factors are female sex, family history of social anxiety, and early childhood shyness. And what conditions go together with SAD? Often the comorbidities are other psychiatric disorders, for example, mood disorders, other anxiety disorders, and also personality disorders. And studies suggest a correlation between social anxiety and substance use disorder, particularly with alcohol and with cannabis. So the hallmark of social anxiety is excessive fears of scrutiny, embarrassment in social situations. And it can come together with symptoms, physical symptoms, such as blushing or sweating or trembling or palpitations when in certain situations. It brings avoidance behaviors, so leading to not wanting to do certain things, not wanting to go to a school function or work function or a party or events, or potentially not wanting to go anywhere. Social anxiety typically emerges in mid-teens, and it can persist into adulthood if left untreated. It is important to treat it early, and treatment response varies. With cognitive behavioral therapy and medications together, we have the best efficacy shown in research studies. And long-term treatment may be necessary to keep remission and to prevent relapse of this condition. The diagnostic criteria for social anxiety include this marked fear or anxiety in social situation, avoidance behaviors, and significant distress or impairment. And the differential diagnosis is essential to rule out other mental health conditions with similar presentations. There are a variety of treatment options, and treatment decisions are based on patient preference, with options including CBT, medications such as antidepressants, serotonin antidepressants, combination of both, and lifestyle treatments, as well as mind-body treatments, psychotherapy of different kinds, so all kinds of different options. Based on research, CBT has the most efficacy in changing the maladaptive thoughts and behaviors that come with social anxiety. The medication options is usually SSRIs or SNRIs, and they have been shown to be effective in reducing symptoms. We have less research on non-medication and non-CBT treatments, but there's definitely promising research on some of these mind-body treatments and other therapies. So overall, social anxiety can have a big impact on people's lives. It's important to take it seriously. it's important to seek a mental health professional for diagnosis, for treatment, for support. And if you're struggling with social anxiety, remember, you're not alone. This is a very common condition, and we do know of effective treatments that can help you manage and overcome your symptoms.